Namaskar. Happy Doctor's Day. So today we had celebrated the birthday of Dr. Bidhan Chandra Roy. So let's have some interesting uh, perspective. Let me ask one question. What does it truly mean to be a doctor? Is it doctor merely someone who diagnoses a disease and writes a prescription? Or is the physician also responsible for the health of a mother, the future of a child, the cleanliness of river, the design of a city, and perhaps even the direction of a nation? On July 1st, India observes National Doctors' Day in memory of Dr. Bidhan Chandra Roy, an extraordinary man who was born and died on the same date. But the real wonder of his life was not this coincidence. It was the extraordinary completeness with which he lived the calling of medicine. More than 3,000 years ago, the Atharva Veda imagined a healer whose responsibility extended far beyond treating an isolated illness. In one of its healing mantra, the physician seeks to recover the patient's breath from the wind, sight from the sun, and stability for the mind. He prays that the patient's lean, speech, consciousness may return to harmony. The Atharva Veda speaks of medicinal plants that give life, of food that sustains recovery, and of waters that are described as being more healing than the healers. It presents health as a relationship between the human being and the surrounding world. The ancient physician was not simply a dispenser of remedies. He was the protector of prana. Prana means the vital force of life. And when we look at the life of Dr. Bidhan Chandra Roy, we find a remarkable modern expression of that ancient ideal. Dr. Roy possessed exceptional clinical and therapeutic acumen. His medical knowledge was vast, but his greatness did not come from qualifications alone. FRCS, MRCP, many accolades he had. He understood that a physician must observe the whole person. The symptom was important, but so were the patient's food, habits, surroundings, emotional state, and confidence in recovery. His diagnostic ability became legendary because he listened before he labeled. He examined before he investigated. And he treated the human being, not merely the disease written on the case sheet. That was perhaps his first lesson for modern medicine. Technology may support clinical judgment, but it cannot replace attentive observation, disciplined reasoning, and compassionate presence. Then Dr. Roy, Bidhan Chandra Roy, did something even more remarkable. He expanded the boundaries of his clinic until they included an entire state. His entry into politics was not a departure from medicine. It was medicine practiced on a larger scale. As a physician, he could treat one patient with tuberculosis or malnutrition or an infection. As a public leader, he could address the conditions that produce disease: poverty, overcrowding, poor sanitation, unsafe water, inadequate housing, and lack of access to healthcare. For him, governance became population level therapeutics. Population level therapeutics. West Bengal, after independence and partition, was like a critically ill patient, wounded by displacement, scarcity, unemployment, and of course, social unrest. Dr. Bidhan Chandra Roy approached these challenges with the mind of a clinician, assess the problem, identify its cause, different causes, mobilize resources, build systems capable of recovery. His concern for women and children was equally visionary. Through institutions like Chittaranjan Seva Sadan, most probably in 1926, he had established as Mayor of Calcutta. He promoted healthcare of mothers and children while creating opportunities for women to participate in nursing, social service, healthcare delivery. He understood that the health of nation begins long before adulthood. It begins with the safety of pregnancy, the dignity of motherhood, the nutrition of a child, and of course, education of a young girl. Mother and child health was not charity for Dr. Bidhan Chandra Roy. It was nation building. His vision also anticipated that what we now call environmental health. He raised concerns about pollution of the Hooghly River at a time when environmental medicine was scarcely recognized as distinct discipline. He understood a fundamental truth. When water becomes diseased, communities become diseased. His vision to Kalyani, Salt Lake City, similarly reflected an attempt to create planned urban environments with roads, drainage, water supply, institutions, housing, and space for healthier community life. These projects were not merely exercises in construction. They recognized that the city itself can either protect health or manufacture disease. Dr. Bidhan Chandra Roy treated the city as a physician treats human body, examining its circulation, congestion, nourishment, waste disposal, and capacity for growth. He also believed that doctors must be teachers, researchers, and lifelong students. Clinical practice should generate questions. Questions should lead to research, and research should return to society as a better care. His contribution to education reached beyond medical college. His association with the development of institutions like IIT Kharagpur, IIM Calcutta at Joka reflected a larger understanding. A healthy nation requires not only doctors, but scientists, engineers, researchers, administrators, and ethical leaders. Knowledge itself was part of his prescription for India. We should not claim that Dr. Bidhan Chandra Roy consciously modeled his life upon the Atharva Veda. Yet the resemblance is profound. The Atharvan healer protected bread, body, mind, food, water, plants, family, and community. Dr. Bidhan Chandra Roy cared for the patient, strengthened hospitals, supported mothers and children, promoted education, encouraged research, planned cities, protected public health, and governed a state. He saw disease wherever life was being diminished. On this National Doctors' Day, perhaps the best tribute to Dr. B.C. Roy is not merely to place flowers before his portrait. It is ask ourselves, are we treating only glucose levels, blood pressure readings, and scan reports, or we restoring the patient's ability to live? Do we consider polluted air, unsafe water, maternal deprivation, and unhealthy cities to be a medical concerns? Do we remain students and researchers even after becoming established clinicians? And do we use our knowledge only for professional advancement or for the well-being of the society? The highest calling of medicine is not merely to postpone death, it is to protect prana wherever it is threatened and to create the conditions in which life can flourish with dignity. That was the medicine of Dr. Bidhan Chandra Roy. That was the physician imagined by the Atharva Veda, and that remains the unfinished prescription for every doctor in India. A physician heals completely only when the patient, the community, and the environment are allowed to heal together. Thank you. Namaskar. Happy Doctor's Day to all.